Okay, so what is your name and how many years have you been practicing?
So my name is Nick Pejic, MD, and I've been practicing here at Atlas Psychiatry for about 15 years.
Okay, and what was the defining moment that made you want to become a psychiatrist?
Well, I was initially in general surgery, and I was in Rush University as an intern in Chicago. So I didn't want to become a psychiatrist initially. And I kind of ignored the signs that I might want to do this as a specialty. But I was on call one night on pediatric surgery in the hospital, and I was actually called to a mother's or to a child's room, and the child's mother was there. It was about 3 a.m, and her child was dying actually from cancer. It was very difficult. But they called me to see if I could help the mother out while she was like grieving and she had questions. And I remember getting kind of a burst of energy in terms of motivation and interest in wanting to help her that I hadn't felt before while just operating. Like if you're going to do an appendectomy, you should be interested in that and want to do it and have like a burning desire. So when that happened, I started thinking, like, if I had that much interest at 3 a.m. when I should be sleeping, to help folks who are psychologically suffering, that really was a turning point for me where I started thinking more about doing this.
Okay.
And yeah.
So what inspired you to create Atlas Psychiatry?
Well, I trained at LSU and I had a really good experience and really good mentors. And some of my favorite mentors were doing private practice and had really mastered that. And I wanted to kind of emulate that. But also along the way, I realized I'm kind of a creative person. Like I cared about the decor and things like that more than maybe other people might. So I wanted to create a place that was really refined, that place that I personally would come to if I wanted to seek psychiatric help and treatment. And so I thought, well, what would that look like? And it inspired me to assemble a team to really help patients on all level on an outpatient setting. And yeah.
Okay. How did you come up with the idea of All the Way Well?
Oh, all the way well?
Mm-hmm.
Well, in psychiatry, and I guess in any specialty, there's sometimes when like you just can't get people all the way well. And they have chronic illnesses and it's a difficult thing. And as a resident in psychiatry in my training, I remember really trying to set the bar high and getting people all the way well. But at the time, we didn't have ketamine treatment and transcranial magnetic stimulation. For example, for like treatment-resistant depression, you'd have to do ECT, which is kind of a big leap because you have to do anesthesia. You have to go under anesthesia and go multiple times, sometimes multiple times in a week. And as I jumped into private practice here and kind of created Atlas Psychiatry, I realized that that if you, well, one, as we went, we adopted ketamine as a treatment, which is now FDA approved. It's called Spravato, and then transcranial magnetic stimulation. And I realized with those tools, plus with all the therapy we've included at our clinic here, all of that together could really get somebody all the way well. Whereas before, just with medication and no therapy, meaning like I'm prescribing and perhaps they didn't have a therapist in the community or they wouldn't want to go to a therapist in the community, like they trusted me but in medication, I just wasn't seeing people getting all the way well or approximating that as much as I would like for my standards. So that's when I started saying, well, what if we had the right type of therapist in-house who I can, monitor the quality of the therapy and also vet the therapist that we're hiring on. So we started there and we adopted some of these other technologies. And then, I messaged patients like, we're not settling for anything less than getting somebody all the way well. And oftentimes that just means somebody's able to work or somebody's able to love, like in other words, being in a relation, like a successful relationship. which is kind of like my metrics for getting somebody all the way well, among other things, but those are the main things.
Okay. Tell me what makes Atlas different from other practices.
Well, I think we're different because we have assembled all the tools that in an outpatient setting that one would need to get all the way well. And like if you go to a doctor, like when people are just finding folks on the internet, they don't know that doctor's training or their specialization all the time. And you're often just going on a recommendation from a friend or something. So you have to be properly diagnosed and you have to be properly treated. And at Atlas Psychiatry here, I spend 90 minutes with them for their initial evaluation. So it's the initial evaluation is always with one of the psychiatrists first. And we have a pathway where we really understand all the symptoms that somebody might be having. And then if we don't know clearly what it is, we try to get more collateral from family and from and just time spent with the patient. And so we really want to nail down the diagnosis, because whatever treatment you have has to match the diagnosis. And then on top of that, the treatment phase, we coordinate care just under one roof here. We actually have 2 locations now, but we all work in tandem together to get somebody really functioning well. And if something's not working, we can swap out one therapist with another therapist who may have a different technique. And that's what's made us different, in that patients don't have to go elsewhere to figure all that stuff out. We can do it for them, under my guidance or Dr. LaRose's guidance here. She's our other psychiatrist, rather than, run around town looking for a solution.
Okay.
Yeah.
And finally, what plans do you have for Atlas this year?
Well, we just opened up our new second location on Magazine Street. So we're a boutique firm, and being boutique, we're actually on Magazine Street and Antonine Street, where we are right now. So we have offices to fill there, and we're assembling our team. Additional members of our team, and we'll probably have some more group therapy this year, and expanding some of our TMS and our ketamine services. And then we have some plans over the next few years too for further expansion, but the key is not to grow too quickly and to really maintain quality. And I need to be involved and not have to manage too much, and meaning still involved in the case management rather than just the managing of our team.
All right, thank you.
Thanks so much, appreciate it.